So welcome to the session. My name is Liz Dunn. I'm the Safeguarding Learning Project Development Officer. I'm always glad when it's on the slide because I sometimes can't remember the sort of whole kind of extent of my title. But basically, I'm the training coordinator. But we don't just do training, we do learning tools, resources, we have development ideas, and this Festival of Learning is part of that whole new way of thinking about how we can share learning better and how we can get it out to as many people as possible. So I work across Leicester, Leicestershire and Rutland. So everything that you hear in, just going to mute Eric. Everything that you hear in this session is relevant across Leicester, Leicestershire and Rutland. Just to remind you that if you're not talking, if you could keep yourself on mute, please, because background noise can interfere. If you want to speak, put up your hand or use the chat box or just shout out if I don't notice. Because it's good if you ask questions as you go along so that you don't forget what you might want to ask. And I'm going to be covering the multi-agency referral form, or as it's fondly known, the MARF. And this is just an overview session. So I'm literally just going to be talking to you about what it is. And if you've got any questions, like I said, please don't hesitate to ask. But we do a more in-depth 3-hour session where we practice on the form and look at different scenarios, that sort of thing. But this is just an overview, like I said. And we're currently setting up some more of those sessions so that we can, so that people can attend those in October and November. Okay, so the MARF, the multi-agency referral form. It's been around now since I think it was about 2019 when it was introduced. Might have been 2018 actually. So it has been around for a little while, and its concept is that it's one form for all local authorities. So prior to the MARF, people had to fill in different forms when they wanted to refer in to the local authority. But now it's just one form across Leicester, Leicestershire and Rutland. It's also one form for early help and social care. So at whatever stage of sort of safeguarding or concern you're at, you can use the same form to get support from the local authority, if that's appropriate. It uses a signs of safety approach, which is a common approach used by all 3 local authorities. I'm not sure if you've heard of signs of safety. Some of you will be totally sort of enveloped in signs of safety, but it's basically an approach that works alongside families. So when Eileen Munro did her review of child protection, what she realised was that people didn't know why social workers were in their home. They didn't know what they had to do to get rid of them. They didn't know what the concerns were. They also didn't know who were social workers and who were people from different agencies. So they didn't understand the difference between some of the workers that were there. So what this approach does is it tries to streamline some of that. And instead of doing 2 families, it works alongside. So it's getting them engaged, because we know if families are engaged or children are engaged, they're far more likely to respond in a positive way and do what they're being asked to do, as opposed to if somebody says you've got to do that and is very dogmatic. It uses really simple language so that anybody can understand. It also engages well with other partners that might be involved as well. So it's a whole sort of multi-agency networking type of approach to safeguarding. So that's signs of safety, and there is a session on signs of safety on Wednesday. It's a twilight session. I think it starts at 4, but anyway, if you wanted to know more about signs of safety, that's there. It's also one form per family. So you may have a child that you're working with that you know is a part of a group of siblings, or you may work with two of the children. They may be in your youth club or in your school or wherever. Or you may be working with a parent that has several children. So it's one form per family. What it does is it creates an evidence trail of what information was shared. So if you put in a MARF form, it starts to build that story, or it adds to a story that's already there. So it's that evidence trail for you in your agency. It might be the beginning of you being engaged with the local authority, and it gives you that evidence trail. So, you know, if anybody says, what did you do about that? You can say, well, here, I submitted this MARF. This is what I wrote. And also, and you need to be aware of this, that it can be used to support any assessment of the child. So what you write in the multi-agency referral form in the MARF can be used to support an assessment. So it may be lifted and put into an assessment, your words. So think about that. Think about what you're writing on on your MARF. Okay. Now, the basis of the MARF comes from the threshold for access to services for children and families in Leicester, Leicestershire and Rutland. Now, this is the 2019 version. It's literally being updated as we speak. In fact, I hoped it would be uploaded for the beginning of the festival, but unfortunately it's not quite there yet. But it has been agreed. So this new version has been agreed. And you'll be thinking, well, why is Liz showing me the old version? Let me just reassure you, it's not really changed, it's just been enhanced. So the main body of the threshold document is almost the same. There's been some tweaking of language and in terms of safeguarding and working together, that's also been updated, but other than that it's the same. But what there is at the end of this document, and I'll make sure that you get the link to the document, is that at the end there's a table, and that table is sort of indicators of abuse and neglect, or where we might have concerns, and they've enhanced that table of indicators. And where that might be helpful to you is it gives you an idea of where a child might sit on the threshold, and I'm going to come on to talk about the threshold in a minute. And so it gives you also some sort of leverage if you're perhaps trying to make a referral in, to say, well, actually, it says in the indicators that that is a concern that sits in tier 2 or sits in tier 3 or sits in tier 4. So if you're making a referral in, it would be tier 3 or 4 that you'd probably be looking at. So you're thinking, well, I know some of you have been in the earlier session, the opening session, where I talked about this particular slide before, but if you weren't in that session, then this is the threshold in a pictorial form. And this talks about what services children use. So tier 1 is universal services. So that's schools, that's GPs, that's youth clubs, that's services that any child can access to help them meet their needs and to help them develop. And most children sit in tier 1. Most children grow up healthily in tier 1. They don't need any other support other than universal services. And that tier 1, and I said this before, but that tier 1, if it was this diagram was correct in terms of diagrammatically correct, that green would go right round, bordering onto the maroon, because most children are in tier 1. So I can't really emphasize that enough. So when we're talking about tiers 2, tiers 3 and tiers 4, we're talking about a small amount of children in our population nationally and Leicester, Leicestershire and Rutland. So tier 2 is a child with some additional needs. So they might require a service to help them meet certain milestones, to help them access certain learning. So for example, it might be speech and language, it might be a behaviour, some sort of behaviour support in school. So there's lots of different children whose needs are met in this tier 2. And this is where we start to see a lot more use of some of our early help services in the voluntary and community and private sector. But also statutory agencies such as health and schools would be involved here. So it's supporting children, but they have only a few or one additional need. When we move into tier 3, this is children with multiple needs becoming more complex, and they require some targeted support. So it might be 2 or 3 agencies working with them, and they need to work together so that the children and the family understand what's happening and how they can respond appropriately, and so that you're not repeating work, and so everybody knows what's going on. And that could be outside of the local authority still. So that could be there could be a lead professional in a school or in health. But it's also the point where you might start referring into the local authority early help sector to say, actually, we need somebody to coordinate this. We think there's some services that you have in early help that we can use. So that's where we'd start to think about coming into the local authority in tier 3. And then if we go up into tier 4, this is acute statutory intervention. So it's social care in the local authority. So that would be a child in need or child protection. It could be the police. It could be inpatient sort of help in mental health, in child and adolescent mental health. So it's really the extreme end of working and complex end of working with children, and there's very, very few children who fit in that tier. That would be very tiny if it was diagrammatically correct. So what you also need to know, you can see in the middle that the arrow goes both ways, and round the middle as well, the arrows go both ways. So you could have somebody that came, child protection, very concerned, came in as a tier 4 referral into children's social care. And actually we find that if we put in a little bit of support, a bit of help, somebody perhaps moves out the family home if that's a concern, then it might go to a different tier. It might then be in tier 3 or even tier 2. But what we also need to know, so when we're working with other agencies, sometimes we think, well, if it gets to tier 4 and it's children's social care involved, then or even CAMS involved, then we don't really need to be involved. But it's not always like that. It's most likely that you'll be working in a multi-agency way. You're not handing over necessarily this child or this young person or this family. You're still working with them, but you're just trying to pull in more the appropriate help for them at that time. So the voluntary and community sector, I'm thinking about them because this festival is about including them in this in safeguarding, and they are very important in safeguarding, but they can sit along any tier really. So we definitely have people in tier 4 who are still working with our voluntary and community sector. Some of them are commissioned services, in fact, that we would use in tier 4 to help support families. So the voluntary and community sector sits right across that board. So it's not just in the early help part of our work that we think about the voluntary and community sector and private sector. It's right across that range. These 2 slides are just there. They're what I've just explained to you, but they're there so that when I share the slides, you've got the description of what the tiers are. But this description is straight from the threshold document. So it's not, it's not what I think it should be. It's straight from the threshold document. So it's what the threshold is. But where people sometimes get confused is, what is early help? Now, in Leicester City, the early help service within the local authority is called early help. In Rutland, it's also called early help. But in Leicestershire, they've now changed it to the Children and Family Wellbeing Service. And I think they've done that to try and separate it from sort of this broader term of early help, because early help sits outside the local authority. It also sits within the local authorities as well. It's a much broader set of services than those that are just in the local authority, because it's any non-statutory service supporting families. So think about how many people that could include. So providing early help is more effective in promoting the welfare of children than reacting later. Early help means providing support as soon as a problem emerges at any point in a child's life, from the foundation years through to the teenage years. So you can see that it's not just about, here we've got a baby, okay, let's provide some support. If there are no issues, we wouldn't need to provide any support, would we? It would just remain in tier 1 and have support from midwifery, and then health visitors, and then nurseries, and or childminders, those sorts of, universal types of services. But if there are some concerns with that baby, or when that baby becomes a toddler, that's when we could support. So early help can be at any point along their development when the issue arises or problem emerges. It can prevent further problems arising. For example, if it is provided as part of a support plan where a child has returned home to their family from care. So that's if they've gone in at tier 4, a child in care will be tier 4. But then we've done some rehabilitation, they've been allowed to return home. So it's moving down the threshold, but they might need some extra support to prevent that child coming back into care and to maintain them in the family. Or in families where there are emerging parental mental health issues or drug and alcohol misuse. And we know that these are issues that impact on the development of children. They can mean that the parents aren't attentive, or are absent, whether that's physically or emotionally. So these are issues that we would have concerns about in terms of the development of a child. Now, that's the definition from Working Together to Safeguard Children 2018. And that is the guidance about, it does what it says on the tin, working together to safeguard children. So it's a guidance that tells us how we should work together. I actually think it's quite an accessible document. It's got flow charts and other things. It talks about child protection. It talks about what people's roles are. It talks about the importance of early help. So we know that all those agencies that work with the statutory bodies are really vital in safeguarding and supporting children. And if we didn't know that, it tells us in Working Together anyway. So and then if you're from a school, so keeping children safe in education is actually comes out of Working Together, but that would be the document that schools would work towards. But the messages are aligned, obviously. And then just to reiterate, really, early help means providing help for children, young people and families as soon as problems start to emerge, or where it is likely that issues will impact negatively on children's outcomes. They can also provide help for families when they are already involved with statutory and specialist services as part of a plan to support them to no longer require this level of involvement. So that's what I've already said. So they may already be involved with statutory services, but there's still a role for early help services. And even within the local authority, early help services will work with children's social care to support children and families. Okay, is that all right for people? People okay with that? Just let me know if there's anything you want me to explain any further. So working together to safeguard children, like I've said, this tells us how to work together to safeguard children, and it's guidance that takes all the laws that are relevant at the moment in terms of safeguarding and translates them into this one document so that we know what to do. And that says that local areas should have a comprehensive range of effective evidence-based services in place to address assessed needs early. So it's saying that local authorities, local areas should make sure that you have an early help offer. And these are the links to the early help offers for our 3 local authorities. And they evidence a broad range of different services. And you can see they're saying evidence-based. So it's not just on a whim, I think I'm going to just set this up and this will be really good. Of course it might be, but some evidence that what you're doing is working, it's supporting children and or families, and that it's making some changes or supporting change. So it has to be evidence-based. So then we come along to the multi-agency referral form. So the MARF is a form that you would fill in if you wanted some support from the local authority. There's the links on how to get to it on the Leicestershire and Rutland Safeguarding Children's Partnership website and the Leicester City Safeguarding Children's Partnership Board website. So there's 2 children's partnerships across Leicester, Leicestershire and Rutland, one for Leicestershire and Rutland and one for Leicester City. But we all work to the same set of procedures, and we all use the multi-agency referral form. So that's how you would access it. And actually, if you went onto the website and pressed report concerns, both of them have a big button on that says report concerns. If you click on that button, it takes you through to a web page that has all this information on. So everything that I'm telling you now and more is on that web page. So if you forget this or you can't remember, just remember that the websites have lots and lots of information on them for people when they're working with children and families. So although it's the same form, it is used slightly differently in different agencies, well, different local authorities. And unfortunately, it's just how it was set up and how systems work. So we couldn't do them all the same. So Leicester City will ask you to call them first. So they have a phone number and they will ask you to call them first. They'll then discuss the referral with you, decide whether it should go to children's social care or to early help, and whether you need to fill in a MARF. So actually it's quite a good service in terms of you get some advice as you're thinking about what do I need to do. If it goes to children's social care, that's the duty and advice service. They'll progress the referral after the discussion and won't wait for the MARF to come in necessarily, so that there's no delay. But if it goes to the early help team, they won't progress it until the MARF is submitted. But if it goes to the early help team, what the early help team also say is talk to them as well. So if you go through to DAS and they say it's an early help referral, filling them off, they say, actually, could you just put us through to early help, because discussing it with early help as well might help, because it might be that they already know about the situation. It might be that they can signpost you to other services and that a MARF's not necessarily required. So they do say, give us a ring, have a chat about it. In terms of Rutland, they operate the same as the city. So they want you to ring first, and then you'll be asked to submit a MARF to social care or early help. And obviously it's a much smaller authority. So I know prior to COVID, they all used to sit in one office, but they do work closely together to try to get the referral to the right place. And when I delivered multi-agency referral training with Rutland, what they said was, we're not trying to stop people from getting a referral in. We just want to work with the children and families we should be working with. So although there's a threshold, that's a threshold so that everybody gets the right support. It's not a threshold so that we can keep people away. And if you really think that your referral should come in to social care or to a point in the local authority, that conversation is really important in us understanding where you're coming from. And then first response for Leicestershire would ask you to submit a MARF at the outset. because they triage them. So they triage them regularly. Obviously, that inbox is monitored all the time. Unless there's an immediate issue. So if we're talking child protection, something needs to happen now, then you could ring in or you could call the police, whichever was most appropriate. But they do have a professional helpline. The number's there, and it's not open all the time. And I have anecdotally heard that it can be quite difficult to access. However, when you do get somebody on that line, they're really, really helpful. So if it's not a number that goes to the public, it's a number that's for professionals to ring in if they've got any thing they want to discuss or they're not sure, that sort of situation. Because the MARF is a form to request services from early help or children's social care within the local authority. It relies on you providing clear written evidence to support your requests for services and understanding what service they are requesting. So that's not saying that you need to know specifically. I think that this family should have 3 sessions of bereavement counselling and then some support with parenting. It's not that sort of specific report. It's more about, do they need children's social care or do they need early help services? So it's helpful to know what it is that you think you're requesting. And like I said, some people find it difficult to know where early help stops and children's social care starts. And actually, if you submitted something because you thought it was children's social care, then that referral of the MARF would, when it was triage, would automatically go to early help if it didn't hit any of the children's social care thresholds. So it doesn't matter in that sense, but it's better if you have an understanding of what could be available or what might be able to help. Equally, we've had early help referrals put in, and when an early help assessment's been done, it's been boosted straight up into children's social care because of the level of concern that's come from that assessment. Okay, so it says here at the end of the form, you choose whether you're requesting early help or children's social care. I think they're online, so I think they're actually the sort of box where you request early help or children's social care is at the beginning when it's online. But in the original form, which is the form that Rutland use, then that's it's at the end. But basically, it's asking you a question. What are you asking for? Do you want children's social care or do you want early help? Okay, is everybody with me so far? Yeah. Okay, let me know if there's anything you want to ask. Okay. What makes a good referral? The age-old question. This first seems obvious. Name, date of birth and address of child or children and any family members you know about, plus any contact details. Never assume that the local authority already knows. People move around a lot. People change their phones a lot. So contacting people can be really, really difficult. If they've just come into your service and that's why there's a concern, you may have the most up-to-date information of all. So anything that you know about the child, the family, where the household that they live in, any addresses, any dates of birth, that's always really, really helpful to the local authority. Number 2, your details and any actions that have been taken and that people that have been contacted since the concerns have been raised. So if you're in an agency and you've got a concern, there's possibly things that you can do already. So it may be that you can offer some, if it's schools, obviously you may be able to offer some support to the child within your school, some pastoral care. If it's a different agency, it might be part of your remit, a youth club, that you can offer some other support. What have you done? So we've put them in touch with a mentor. We know about this service. We've put them in touch with this service. It can be other professionals outside your agency, but what have you done? So you've got a concern, you've not necessarily gone straight to the local authority because there's things that you know can help. You've got a food parcel, you've arranged somebody to pop round and check that the children are up in the morning, whatever it is that's within your role or remit and it's possible for you to do. If you've done some of those things, write them on the MARF. Everything that you've done. You've contacted this person said we can't help in that situation. You've put the parents in touch with a drug advisory support group because that's what you're concerned about. If that is, what have you actually done? And then why you're referring. Obviously, it's going to ask why you're referring. So your involvement with the child and family. And then you see it says, including the parents' views of the concerns if obtained. Now, at every point during the MARF form, it will say, including the parent, carer or child's views. Because what we expect you to do is talk to the family and the child about the referral that you're making. If you're making a referral to early help, they need to know that you're making that referral. They need to, I'll come on to this a bit more in a minute, and it's good practice if you're referring to early help to probably, fill in the form with them or directly say, well, I'm going to write that on the form or show them the form. That sort of behaviour is totally appropriate because it's about them. So what's been your involvement? I feel we can support the family. Mum doesn't want any support. So you can put that, or mum says she wants this, but not that. What are you worried about with factual evidence? So there's a box that says, what are you worried about? So specifically, what are the concerns? I'm worried that there seems to not be the appropriate amount of money. I know that there's low income coming into the house, or not very much money coming into the house. The child is dirty. I'll come on to that in a minute. They don't seem to have the right equipment, clothes, bags with them. So what are we worried about? What have you already done? So I talked about that. Where do you think there might be strengths? So this is the signs of safety bit of it. Signs of safety as well is a strength-based approach. So what that means is that we look at what's working well and we build on that. So if you've got a child that you've got concerns about, but actually they're coming to school every day, they're coming to school or nursery every day and they're turning up at the right time, that's really positive. Why is that? Why is that happening? What's working well there? Perhaps they've got support from another family member or a friend. So that's something we can build on. That's a strength. And that when you're talking to families, if you can say this is working really well, it's a way of starting to work with a family so they don't feel like you're just saying, change this, change that, change the other, then you might be all right. What you're saying is actually this is working really well. How can we, make it so that this area is working as well as it possibly can be? So it's a strength-based approach. And we do get a lot of MARFs where people put there aren't any strengths. But even if they've consented to you filling in a MARF or to getting some help from early help or social care, that's a massive strength because they're recognising that they need some help. So try to, think broadly about what strengths might be. And what action do you expect social care early help to take? What is your expectation? So this is a bit about what do you think should happen to make things work better? What do you think could be a support to this family? And like I said, that doesn't have to be specific services, but a broad idea of what, so some parenting support might help. A look at benefits, whether they're getting the right benefits. I mean, you may have already done that. You may have gone to somewhere like the Citizens Advice Bureau or suggested they go there to get support with that. So, what else might happen? Question 4 is, and they're not actually listed in this order, but on this slide, the 4 is the details and information about any other professionals that might be involved. Health, education, police, youth justice, or any other agency. Youth justice, youth club, Turning Point, Home Start, somewhere like ADHD Solutions, Centre for Women and Families. There's hundreds. I'm sure you're crying out with different services that might be involved. If you know If you don't know, that doesn't matter. If you know that services were involved, you can put that, but make sure it's obvious that they're historical. So I do know that the local authority early help service was involved last year for 3 months, or last year, but they're not involved anymore. So whatever you know, put in that section, because that helps us to create that, grow that picture as well. It is important that you give as much information that you have in order to ensure any assessment is comprehensive and as accurate as possible. Okay, so just as much information as you can that's relevant so that we know what's happening with the family. If this is the first bit of information that the local authority has about that family, and it just says, I'm worried about Jamie because he smells, and when I spoke to his mum, she told me to F off. That doesn't give us very much. It gives us a bit, and we'd be concerned, but it doesn't give us very much. So this is the support we put in for Jamie. This is what we offered mum. We tried to speak to dad. He didn't answer the phone. You know, whatever you've done, as much as possible. So, key questions in the MARF. Like I said, have you told the parent, carer, or young person that you are making this referral? I'll come on to sort of information sharing in a minute. So you must tell them, unless it's a sort of child protection issue where you're calling in because it's so concerning, you must tell them that you're making a referral. Has the parent carer indicated their engagement and cooperation with this referral for services? Are they saying, that's okay, yes, I'd like some help? And what you might find is that with children's social care, you're probably going to get quite a lot of defensiveness about social workers coming in and taking their children, because unfortunately that's still the sort of image, and it's sort of played out in the media that people have of children's social workers, that they're just coming to take your children away. In reality, it's very, very difficult to remove a child from a family, and you need a lot of evidence. However, early help services aren't social workers. And so this might be a way of kind of saying, actually, these are support services so that we don't get to this point of social care, hopefully, but can help you now. So if they've said they'll accept some of that help, that's really, really useful. Okay, I've said that already. Said that. So that's how they're listed. So if you see, it says, what are you worried about? Include the child and family's views. What is working well? Include the child and family's views. What needs to happen? Include the child and family's views. So you can see this isn't a document that you just go and sit in an office and fill in without having had any conversation with anybody at all. It's something that's done with, for the most part. Okay, so I'm just going to talk a little bit about information sharing. Because since GDPR, people have got very, very wary about sharing information. But actually, in terms of safeguarding, GDPR doesn't make any difference. So GDPR is really for things like sort of insurance companies when they sold your details on, or if you go into a shop and they say, can I take your email? They need to tell you what it is they're going to do with that email and your details. But in terms of safeguarding, you're allowed to share safeguarding information without permission. So information sharing, where practitioners need to share special category personal data, they should be aware of the Data Protection Act, which says that safeguarding of children and individuals at risk is a condition that allows practitioners to share information without consent. It can be shared legally without consent if a practitioner is unable to or cannot reasonably be expected to gain consent from the individual, or if to gain consent could place a child at risk. That isn't most cases. That's a small minority of cases. So if you're worried about a perpetrator of abuse, perhaps, or so if you asked, it might make the situation worse. So all those sort of high-end issues might stop you from talking to a parent, but that's not the majority of cases. That's the minority of cases. Also, relevant personal information can be shared lawfully if it is to keep a child or individual safe at risk, safe from neglect or physical, emotional, or mental harm, or if it is protecting their physical, mental, or emotional well-being. So there's the early help end of safeguarding. You can share relevant personal information if it's protecting their physical, mental, or emotional well-being. And that's in information sharing advice for practitioners, providing safeguarding services to children, young people, parents and carers. Again, a really useful document, especially linked with our own sort of information sharing document that's on the Safeguarding Children's websites, partnership websites. But this is 6 pages, I think. Again, has flowcharts, says where you can or can't share information. So it's really quite comprehensive and useful government document. But, haha, I hear you say, you thought there might be a but. And this is where I talk about working in partnership. As a professional, you have a duty to be open and transparent. And that's also in the law. So you will need to tell people involved that you are sharing information, who with and why. So unless you're at the very sharp end of something's imminent, immediate, or by sharing information, it would create a harm to the child or anybody else. But unless you're at that point, you must tell somebody. And this can be quite difficult for people because it has the potential to upset relationships. Sometimes relationships you spent a long time building up. But what I would say to you is, if I saw something, so I saw a mum, Sarah, I saw Sarah, and I'd been told she hits, what should I say? She locks her children in a cupboard overnight. Somebody told me this. I then went round one morning because I take the kids to school. I saw her unlocking the cupboard or talking about the cupboard. So I know this happens. I could just report that to the local authority. When the local authority receives the referral, they'd go out and see Sarah and they'd say to Sarah, and you know, we know you're locking your kids in a cupboard overnight. And Sarah had said, oh, who told you that? And they'd say, Liz Dunn told us. So that's going to really, really damage my relationship. If I see Sarah taking the children out of the cupboard and I say, Sarah, gosh, I've just seen you do that. I'm really worried about that. I don't think that's a really that you should be doing that. I'm worried. I'm concerned about these children. So I'm going to tell the local authority, and I think they might be able to offer you some support. Now, she's not going to like me very much, and she's not going to be happy that I'm doing that. But when we go through the next bit where I make the referral, they go out to this to see Sarah. They say, she says, who told you? They say, Liz Dunn told you. There is one part of the relationship that's salvaged because at least I've been honest. So although Sarah doesn't like what I'm doing, she doesn't like what I've said, but she knows that I've done what I said I was going to do. And actually, sometimes that's the really important bit, that you're actually protecting that relationship in some form because the honesty and the integrity is still there. And then you can refer back to that and you can say, you know that I wouldn't lie to you. It's actually early help that are coming to support you. They're going to try and help you to manage your children without putting them in the cupboard. So, you know, there's perhaps a way in. Okay, so they can say they don't want you to share the information, but you can still share it. Whether you have permission or share it or not, the people involved can still refuse a service that is offered. So if we've got a situation that didn't hit Section 47, and Section 47 is a child protection investigation, and that threshold is cause to suspect that a child who lives or is found in their area is suffering or is likely to suffer significant harm. So we're looking at the threshold of significant harm for a child. If the child doesn't reach that threshold, then the local authority can't work without the consent of the family. So we might have concerns in terms of child in need. We might know that there's hundreds of services that could be offered that could help this child. and that they are children in need. We've been assessed, or we think they're children in need. If that family says no, go away, do one, there's nothing that we can do without consent at that point, except try to be persuasive. So try to say, well, actually, you know, if you got this support, that might help. But also, that could be part of the MARF, that you've offered this help, that you've put in a MARF before and it was refused, because that helps to build the picture. Like I said, that helps to build the history of what's happening here. So if a child in need has 4 times been refused, they've refused any services, that raises our concerns, doesn't it? Because we don't know what's really happening in that family. So that might tip it into significant harm, because it might be that they are likely to suffer significant harm, but we don't know. We need to find out. Okay, is everybody with me on that? Okay, yeah. So I'm just reiterating, any assessment along the continuum is a voluntary assessment process until that Section 47 child protection, that threshold of significant harm, has suffered or is likely to suffer significant harm. Therefore, a child or young person must agree to the assessment being done and also to the service or intervention. This means that they understand, because we clearly tell them what we're going to do, who we're going to ask for information, and what will happen with the information. It's an open process. So I think there's always been this idea that sort of safeguarding is a bit secret, and that we can't tell people this and that, and we shouldn't be bandying around general conversations for all and sundry to hear. But in terms of passing on information to relevant professionals, that's something we can do. And then it says there, even for a Section 47 investigation or assessment, agreement will be sought to support the process. It's very, very hard to work with people if they don't want to work with you. So even at that Section 47, we'd be trying to get some sort of agreement to what's going on, because it would make the process a lot easier for everybody, especially the children. So I'm talking about consent. We need consent to work with families, except at Section 47. But at Section 47, if we got consent, it's much, much easier. Okay. Now, you probably know principles of information sharing, but they're really relevant for the MARF. We want necessary and proportionate information. So while I'm saying tell us everything you know, not everything you know, everything relevant to this situation, this worry, or this family that you think we need to know. So necessary and proportionate, relevant, adequate, so enough. So I've said that, we don't just want 2 lines. We want everything that's relevant and why you've got concerns. A few times. What does a few times mean? Is it 7 times? Is it 2 times? Is it 20 times? How many times? Be very specific. So it says accurate as well. Specific, accurate, dated, distinguish between fact and opinion. You can give us an opinion, but it must be stated. If it's historical, let us know it's historical information. It's okay if it's relevant. Timely, so we need to refer as soon as we think we should. Secure. Now, if you're referring on a MARF, that process is a secure process. But I think, in terms of flexible working and working in different areas now, we need to think about what we're doing. So I'm currently at home in a I was going to say spare room. It's a bit glamorous. It's a junk room, to be fair. But there's nobody else in this house with me at the moment. If I had children or other people here who could see what I was saying or see what was on my screen, that wouldn't be appropriate in a safeguarding situation. Equally, if we're in phone calls, we're phoning people, they might ring us back. We could be anywhere. We could be out shopping, getting our lunch. We could be in a busy area. So always be aware of who's around you, more so now that we're working in such a flexible way. Even in our offices, it might not be appropriate for people within our office to hear. So find an appropriate place to pass on information, to share information, and make sure that you're sharing it with the right person. Check who it is that you're sharing it with. And recording. Make sure everything that you do is recorded according to your policies, your safeguarding policies and procedures, because that's really, really helpful. And it shows as well that you're doing what you should have done. So if you're following your policy and procedure, you're never going to have any comeback that says, oh, you shouldn't have done that. And if you record that you've done that, it's fabulous. That's better for you. So just going over facts, it should be as factual as possible. You can give opinion. You should have evidence. So an opinion might be, I believe she was drunk. The reason I believe this is because she was slurring her speech. She stumbled a couple of times. She smelt of alcohol. So that's an opinion, but there's a definite evidence base for that opinion. Hearsay is an interesting one. You can put hearsay in because it might be relevant, but you need to say it's hearsay. So be very clear that it's hearsay. If you can perhaps triangulate the information, so it might be that you can ask the person specifically, if you overheard something, go and ask them specifically, either the person who was saying it or the person that it was about, depending on what the information is. That's much better. But if it's not possible to do that, just make sure you're clear that it's hearsay. And this in blue, what you write in a referral can be used in an assessment. And why is that important? It could be admissible to court, which means they might see what you've written anyway. So when we say it's good practice to write next to somebody, that's why we're saying that, because it could be admissible to court. They could see it anyway. And so it shouldn't be a shock. Nothing that's on that form should be a shock. So think about how you write things and how you discuss it with the family and the parent or the child. So all multi-agency referral forms, so all MARFs are screened in all of the local authorities by children's social care and or early help. So there's a joint sort of triaging of this, and if it goes to social care, there'll be a social work manager's decision to determine the response within 24 hours. They have to do that. If it reaches section 47, a strategy meeting will take place to decide what happens next. And if your referral is a part of that, you may well be invited to be part of that as well. You should be notified of the outcome in writing, which could be an email by the local authority in terms of the section 47 referral. Most of them know that they're not necessarily very good at doing the written outcome notification, but they're trying to make that better. But you can chase up the referral yourself. And I know you might say, well, why should I have to? But if you're genuinely concerned about the child, you need to know what's happening with that referral, don't you? Don't think you're just handing it over and then, oh, my job's done. It might be that you still need to be involved. Like I said before, when I was talking about the threshold. So, find out what's happening. You're concerned about this child. You want to know what's happening. So, you have every right to know that as well. If the MARF meets the threshold for an assessment under section 17, so that's child in need, so that's still a statutory response, but it's not the threshold of significant harm. We're just concerned, we think this child or family needs support to meet expected outcomes. So you would be expected to be involved in that assessment, definitely, once consent had been obtained, or unless, with that consent of that family. Now that's just literally a flowchart out of Working Together 2018, because what I'm telling you here is what social care has to do, because it says, and early help have to do, because it says it in Working Together to Safeguard Children 2018. So this is the way that early help and children's social care work nationally, because that's what the guidance says. Of course, there's going to be nuances, local nuances, but essentially, broadly, this is how they would work. And you say it's a see flow chart 3 on assessment. So there's lots of different flow charts. Really useful document. So what happens if it goes to early help? So we've talked a bit about children's social care, child in need, and section 47, child protection. So if it doesn't meet the threshold, for support within the local authority in early help. So you might refer in saying, I think actually you could use some early help. Early help will look at it and think, actually, there's services out there that could work with this family that are probably better placed to meet their needs. So they will give you that advice. They will ring you and will signpost you. All of the local authorities review MARFs in early help at multi-agency meetings. So they assign workers, they decide what's going to happen next. And then you'd usually hear from that worker, and that's usually done within a week. So again, if you've not heard anything, even if it's early help, you still want to know what's happening, don't you? Don't just assume something's happening, because you should hear what's happening, and you should be involved potentially in what's happening as well. Now, if there's a decision that's made that you're not happy with, then you can use the escalation process and should use the escalation process. So the first step is to talk with the other practitioner that you're disagreeing with, if you like. So it's a professional discussion. If not, managers speak. If not, we'd have a system where it would be there'd be some person who'd chair that meeting and would work between you. I can't remember what that word is. Work between you to try and resolve the situation. But then it could come to the Safeguarding Children's Partnership Manager. Only then, though, and we don't get very many at all, because most things are resolved at step 1 or step 2. Negotiate, some sort of negotiation, mediation between you to try and get to a resolution, because mostly people want to work with the children they should be working with. So it's not about, like I said, stopping people. It's about trying to get appropriate services to the appropriate place. And if you show that you've followed the escalation process, then that also helps. Should it might be that you think it should be higher up on a tier 4 at child protection, but actually other people don't think it hits that significant harm. If you still think it does, if you follow the escalation process, it's documented what your opinion was in that way. And we have lots of sort of serious case reviews that are then called child safeguarding practice reviews, where people say, well, I thought that, but I didn't say anything because the social worker or the doctor said it was all right. If you're involved in any safeguarding meetings or process, you're there for a reason. And if you're somebody who's spending a lot of time with that child or knows that child and family well, then your view or your opinion is valid. So don't be afraid to present that at the meetings, because if you're involved in safeguarding processes or assessments, there'll be meetings that are there, and as multi-agency meetings. And as part of that multi-agency group, you are part of that safeguarding process. So even if the social worker or the doctor says something different from you, that doesn't mean they're right. They may not know that child as well as you. They may not know that age group as well as you. So what's sort of regular behaviour for that kind of age group, typical behaviour for a 3-year-old? But you know that because you're from that environment. So that's what I would say to you. Your opinion is valid. So if you need to use the escalation process, then that's there for you. Okay, whistle stop tour, like I said. Sorry, that's hard, easy for me to say. Does anybody have any questions? You will get a copy of the slides, and I'll make sure all the links to things that I've talked about are with those slides as well.